Hello, everyone. Welcome to this panel on a late Friday afternoon here in Brussels, certainly. My name is Stephen Erlanger. I'm a reporter here with the New York Times, and I have a great pleasure to being part of this GMF Brussels Forum, but also to have, I think, one of the most important panels that you'll listen to for quite a long time. We've had a terrible 18 months or so in the world. It's not over yet with COVID. We're still fighting about where it started and how it's going to end. But we have with us two excellent experts who are very well experienced in what this disease has looked like, how it's developed, what its impact has been. And what we're going to try to do is discuss the lessons we've learned so far and how they can be applied to any future pandemics. So I think you all see with me virtually Dr. Deborah Birx, who is now a senior fellow at the George W. Bush Presidential Center, was an Army colonel, which is impressive also, and was very important for the US Centers of Disease Control and a White House advisor, and traveled the United States, and is very, very well qualified to talk to us about what went well and what went badly. And also very pleased to have Dr. Srinath Reddy, who is in Delhi, who is president of the Public Health Foundation of India, I think a trained cardiologist, but who has also been a visiting professor at the Harvard School of Public Health, and he's a professor of epidemiology at Harvard and other places also. So welcome to you both, and thank you for taking the time. I'm going to start off in a way by asking, it could be too broad a question, but as we look back at what's happened, obviously mistakes have been made and also good things have been done. Let's start with you, Dr. Birx. I mean, what are one or two things I think that we've learned, that you've learned, that can be applied if such a thing should happen again?
Great, thank you. And I really want to thank GMF. Going back at least 5 to 6 years, GMF recognized that intersection between foreign policy and public health, when many other institutions did not. And so they have had sessions on pandemics and global response and global preparedness. And I just want to thank them for being ahead of the curve, because I think that discussion and bringing health into foreign policy discussions is really key. And I think we've learned those lessons this time. I think one of my really key understanding is unique viruses require unique responses. And sometimes we like to revert to what we know rather than being clear about what we don't know. And it gives me really the opportunity to thank my colleagues around the globe, because they saved literally thousands of American lives by providing the information when they were totally enmeshed in their own crises. But it was that early information that came out of Europe, and particularly Italy, that really gave us insights into how unique this virus was. And unlike flu and unlike SARS, it had a very different pattern of infectiousness, from asymptomatic to severe disease. And my colleagues literally let us know that early so we could get that warning out to the American public. And I think that was really key. So unique viruses require unique responses. And I think naming it, even related to SARS, created a perception around the globe, particularly in Europe and the United States, that this could be handled like SARS. And you remember SARS and MERS, very different virus, less transmittable, but in people's mind, it was containable. In Asia, it had the opposite response, and probably saved many people in Asia, because I worked in Asia during SARS and people were devastated. by the impact of SARS, but the public knew what to do. And so they immediately masked, they immediately physically distanced, and they were ahead of the curve. And so that kind of muscle memory to a pandemic is really key. And I'll just end by really talking about and ending with, we shouldn't be naive. We know all infectious diseases are political. We saw this with tuberculosis early on. We saw this with the 1918 flu. We saw this with Ebola, and we saw it with HIV. Politics have always come into play with infectious diseases, and that is what has always led to stigma and discrimination and a real marginalization of key communities. And I think we just have to constantly be working on that in between these pandemics, and to really have a different relationship with our communities, because in the end, it was communities and knowledge to communities that saved people's lives.
Thank you. That's a very good start, because one of the things that I will always remember about this, which isn't over, is the part of the muscle memory is the political polarization, which has seemed, at least in America, to have had such an impact on who does what. And I find that kind of still something I haven't absorbed yet or fully understood. In Asia, there wasn't this kind of polarization, and you didn't really have it in Europe either. I mean, you had some anti-vaxxers on the far right, but you didn't have main parties saying, you know, wearing a mask makes you a wimp. So this is something we will talk more about, I hope. Dr. Reddy, you are in the middle of a pretty raging pandemic. What have you taken? I mean, you live in one of the biggest, most varied democracies around. And what lessons have you taken from this?
Thank you very much. Well, there are some early signals that the second wave is beginning to abate, but it's too early for us to predict whether it's just a false sense of security as we emerge from the lockdown, whether there's going to be a rebound. We'll still have to wait and see. But for me, some of the lessons from the experience of this time has been that over the last 60 years, the recurring theme of infectious diseases outbreaks all over the world has been zoonotic transmission in more than 2/3 of all the new infectious disease outbreaks that have occurred anywhere in the world. While each of them may have some unique feature, the common thread has been animal to human transmission, usually from forest-dwelling animals and birds to the veterinary population or directly into the human beings. And therefore, it's very important for us to recognize that we are the ones who have been building conveyor belts through our distorted patterns of development, which have a huge amount of deforestation, unplanned urbanization, great emphasis on animal foods rather than plant foods, captive animal breeding, bringing even exotic wild animals into wet markets. And all of these have resulted in an easy passage for a number of viruses into the human body. And therefore, we do require to reset the coordinates of our development in order to try and address these determinants if we're going to be preventing some of the future pandemics, if we're going to be anticipating, averting, and attenuating the future pandemics, we need this amount of replanning. But at the same time, we need very strong health systems nationally and globally as well, in order to firstly build in that one health surveillance systems so that we can actually trace from the wildlife to veterinary populations and human populations the transmission of the microbes, pick them up at the earliest, and then ensure that the transmission does not proceed further. And for that, we require not only better coordination, but also strong health systems also to come in with a strong emphasis on public health and primary care, which have been neglected in most health systems or even developmental paradigms across the world. And that is where we must recognize that unless you have an efficient and equitable health system functioning in the steady state, during most of the time when there is no public health emergency, you cannot build a strong and swift response to a public health emergency when it strikes you. So we need that much better, but not merely at the national level, but also ensuring that since the pandemic is indeed a global threat and highly interconnected world will see the transmission flow, we need a redefinition of our global solidarity.
I think that's a very good start, and all those points very well said. What I don't want to do is get into a discussion of the origins of this virus, which is an intensely political discussion, because we are where we are. And I wanted to ask then both of you, there are two themes that strike me out of what both of you have said. One is resilience, right? Is the resilience of our societies, our preparation for the next pandemic. And the second is something you've just touched on, which is this issue of globalization, let's call it that, though that's not really the right word. It's simply that we travel constantly. And it is very hard for countries to shut themselves down. Some would argue the United States was too slow to shut itself down. People in Britain now are arguing they're much too slow to stop planes coming in from India because of this latest Delta variant. But we've also had issues, particularly in the beginning, about PPE and masks and who has what and how much you'd pay and so on. So I wonder if both of you could talk a bit about lessons. I mean, does this produce a new health protectionism among advanced countries rather than the kind of more equitable sharing that you've just mentioned, Dr. Reddy? Dr. Birx, what do you think?
Well, I think I just want to pick up on something Dr. Reddy said and then continue with your question, because I think he raised a critical point about public health and prevention and access to healthcare. I would add to that a whole different approach to how we diagnose and find diseases. And I think in many of, in Europe and in the United States, if we had been diagnosing flu laboratorily rather than symptomatically, we would have probably seen this virus earlier. Instead, most flu diagnoses around the globe are diagnosed by it's flu season and you have flu symptoms. But I think this has really shed a light on, we really need laboratory diagnosis for respiratory diseases. We cannot keep making presumptions about what people are infected with, because it would have raised a red flag early throughout Asia and then through Europe and the United States if we had people being admitted with flu-like symptoms and they were not positive for flu. And on top of that, we need better antivirals. And so if we had really worked on better flu antivirals and better flu diagnoses, I think the world would have been in a different place. But when you talked about resilience, and I really want to highlight this, for decades, the world has been investing in the Global Fund for HIV, TB, and Malaria, and through PEPFAR and the Presidential Malaria Initiative bilaterally from the United States. It was those platforms that allowed us to test around the globe. So if we hadn't had HIV and the investment in HIV, there wouldn't have been those RNA diagnostic platforms around the globe. So creating tests became much easier than creating new equipment. And I think those investments that were made really paid off in the end as a really critical lesson learned. But we also have to look back on what happened here, because what happened was very different than what the global community would thought happened in a pandemic. They thought pandemics would ravage low and low middle income countries, because this virus particularly targeted the elderly and those with comorbidities, hypertension, diabetes, and obesity. The wealthier countries were more of a target in this virus and really had much more relative quality of population than others. And I think it really will call to action of a new alliance between the upper and upper middle income countries to really ensure what you talked about, supply chains to all of those countries, as well as into our more vulnerable income and low middle income countries. And I think that diversification of the supply chain, making gloves in Africa, having other countries that can make and masks will be key in the end for the kind of response that we need globally, not only to this pandemic, but for to protect people against hepatitis, HIV, and other transmitted diseases where you need gloves and gowns.
Right. Dr. Reddy?
Well, I think it's not only unethical, but also unwise to retreat into ultra-nationalist protectionism. Because you may actually work out, if you have a fair amount of resources, to do well for some time, but in an interconnected, interdependent world, you can't do that. Because your economies are interconnected, and if other countries collapse because of this pandemic, then your own investments are going to suffer. Then secondly, the supply chains will definitely require some elements to come in also from other countries. Third, and equally important, if you do not work to put out the fires elsewhere, variants are likely to develop in under-vaccinated, under-treated countries, and they will travel back to you and you may no longer have protection. So it is absolutely prudent for everybody to put their hands together and then move from a fear of global shared vulnerability to a sense of shared values, which means that we're all in it together and let's help each other and we'll fight it together.
I mean, I've always loved sentiments, but I've been a journalist for so long that I've seen so little action to back up those sentiments that I become a bit cynical, I have to say, because people get very selfish and they worry very much, almost naturally, about themselves. I was very struck, you know, I was based in Southeast Asia for a time and been based lots of places, and I saw this disease moving, and people looked at it like it was some horror movie that had nothing to do with them. And then it hit Italy, and people looked at Italy like it was some horror movie that had nothing to do with them, you know, because the Italians were this or that. I mean, it's absurd. So in a way, this psychology of this disease fascinates me. I mean, it's been a long time since 1918, right? And even I must say, I didn't think it could happen again, not this same way. So is there something we can learn about human psychology out of this that will make us better prepared? Or am I going off on some non-medical tangent here?
Well, I think it's an important concept because what saved the people the most around the globe were individual reactions to the virus that people did. And I think I always felt like we weren't applauding that enough. And we didn't give people enough credit. And I think when I started traveling the United States, the states that didn't have a significant outbreak in March and April, that did really get information to their population and stop the spread. It's so difficult then if you don't go back and say, you did this, you Iowa, you Texas by and large, you really, because of what you did as a community and protecting one another. So we didn't give enough positive feedback. And I think when you want behavioral change like that in public health, you have to both give out the information, but applaud evidence that it was working. And I think we didn't spend enough time at the end of April really highlighting where the virus didn't go and how and why it didn't go there. You made a comment about shutting down late. I will say that we were watching, obviously, in tight communication with our Italian colleagues, and Obviously, they went into a lockdown on the 8th and the 9th of March, first in the northern and then across the rest of Italy. We were watching that carefully, and that's why the 15 days to slow the spread on the 16th. So it was just 7 days later. I think, getting people to understand exponential growth when they're used to linear growth is a really difficult concept, because that's not how we live our lives. Gas prices don't go from $2 to $4 to $8. They go from $2 to $2.50.
It's really hard enough to get people to understand mathematics, let alone exponential figures. No, I mean, I was very struck by this too, because I was due to go to Britain on March 11th, and I looked at my wife and I said, this is nuts, and I canceled it. I mean, because I was getting scared. So, I mean, fear has a function here. But Dr. Reddy, I mean, you live in this incredibly populated, rich and poor country where social distancing is really hard to do. And yet we've always relied on India to produce a lot of vaccines. It's an advanced industrial society also. I mean, are there lessons for countries more like yours than like America that you've taken from this?
Right, I'll answer this question, but I'll also start with the previous discussion.
Please.
In the sense that I think while one of the common features of 1918 and the current pandemic is that it has lasted quite a while. Unlike some of the other outbreaks and epidemics and even pandemics that have actually been relatively short-lasting in the last 30, 40 years. So this time, it has not just touched us briefly, but it has sort of singed our memories very strongly. And I think people are beginning to realize that all countries are vulnerable. So that helps. And the difference between 1918 and now is the speed of communication, global imagery, transmission of information. So I believe if we can take advantage of that, while it is not always easy to communicate caution to people, we can still actually instill a certain sense of discipline as we move along in terms of responding to future pandemics in a more concerted fashion. But coming to the question of difficulty of physical distancing in India, of course it is. But there, I believe, at least using masks and trying to function as far as possible in better ventilated places is going to be the way we should go. And of course, speed up the vaccination as fast as we can.
Yes, no, I mean, one of the questions that's come from the audience, which seems appropriate now to ask you both, and maybe it's not true, but there's a sense that most of Africa has fared pretty well in this pandemic. Are there reasons why? Is it just the experience of Ebola and other things, or what do you think? And are there lessons there for all of us?
Yeah, and then that's what I tried to talk about early. It's really the median age in many countries in Africa is well under 20. And I think really understanding that this virus preyed on a specific set of demographics.
Yeah.
Unlike
my demographic.
Yeah, all of it, our collective demographic. And it preyed on them in a way that wasn't like flu. And I think any of these comparisons to flu, because it both affects the very old and the very young, and also pregnant women, you have a bi-directional, when you're talking about behavioral change, the people in the middle understand the risk. So when you have 20 and 30 and 40-year-olds who have both children and elderly parents, they get really quickly why this virus and why flu can be deadly. This virus, because in the younger people, acute illness, and I'm saying acute illness because we still don't know about chronic illness, but acute illness was almost invisible in many people between 15 and 24, 15 and 35. And that kind of invisibility allowed for this kind of entire world global spread before people were alerted. And I think, again, this gets back to testing in the laboratory and how important that is, not only to be testing at the time of a pandemic, but as you described, in between a pandemic. Because I think that early fear that many of people experienced in March and April, before people understood through social media that young people were getting infected and acutely, didn't have significant consequences. And I think that was really a moment when the fear translated to a different position by many of those individuals.
Right. Dr. Reddy?
Well, I think if you look at what's happened in the world and within countries as well, there's been an almost direct relationship between the level of development and urbanization apart from the age. We see clearly the more economically developed countries with much greater travel density, much greater urbanization and crowd density in urban areas. And they are the ones who have been affected much more. And countries which have been much more rural, much less developed economically, much less levels of travel, and all of them have actually not seen the same levels of transmission. And also, several of these countries which have been less economically developed, whether in Africa or even parts of India, have what we call lower amounts of comorbidities or associated health conditions. For example, rural India would have less hypertension, diabetes, heart disease than urban India. So therefore, the death rates will be much lower. So we see this pattern. Virtually, of course, we cannot say that they're totally insulated from the threat, but the brunt of the epidemic will be borne and has been borne by the more developed, more urbanized, older populations who are richer and travel a lot more.
This is really interesting. It's almost like the disease is Thomas Jefferson's ideal, because we should all be a rural democracy and stay out of the cities, which are fetid places where disease festers, which is an old political trope. But COVID-19 seems to have heard this. And what I want to ask you both, though, is what is wrong with the WHO and how do we fix it?
Well, I think, when I started, that's why I said all infectious diseases are political, because at the country level, no matter what country you are, if you say, I have Zika, or I have Lyme disease, or whatever it is, people don't want to travel there. And so countries see this connection between infectious diseases and their economic growth and tourism. And so we have to rely on WHO to transcend that. And I think when we get through this, and we're still very much in the midst of it around the globe, when we get through this, we need to really look at very carefully how we're going to fix that, because countries are reluctant to talk about their outbreaks for fear of the impact it will have on them economically. But WHO is supposed to be our bulwark against that. And maybe that bulwark needs to be bigger than WHO. And maybe we need to bring the private sector to the table, because this pandemic impacted the private sector in ways that they had never been impacted before. And they may have a greater interest level to be at the table and not rely exclusively on the public sector. The public sector will have a role, but I think if the private sector had been engaged, we might, because we are a globalized multinational, many companies had people around the world. Both the US and the WHO had full-time people in China. That didn't change the level of transparency. Slow to recognize human-to-human transmission, slow to call it a pandemic. And part of that was because we weren't aggressively testing, and we weren't aggressively testing because China was probably not being transparent about the level of asymptomatic spread. So all of these pieces come together, but I think Asia was having been there, and you talk about it too, we were flat-footed in Asia. And I think Asia in that moment said never again. And so they just had to hear the word SARS, and they knew that they had to react at all. The community needed to react, the public sector needed to react, and the private sector needed to react. And now we all globally have that muscle memory, and we need to not sweep this under the rug, because we all have post-traumatic stress disorder related to this and the anxiety, but we need to carefully look at these lessons to make sure that we are not only prepared, but as Dr. Reddy talked about, prepared as a global community.
I mean, part of the problem is with any UN agency, I mean, it's only as good as the big powers let it be. So sometimes I think we should just wipe it out and try again, but that's probably not very realistic. Dr. Reddy, are there improvements that can be done, as Dr. Burke suggests? Can it be broadened out? Will the Security Council allow this sort of change?
Well, the WHO is controlled by the member states, and unfortunately, it is too cash-strapped. It gets its budget from the member states, and even that is not a very large fraction of its overall budget. So it has to depend also on a variety of other donors, like the various foundations. And each one comes with strings, and that's a big problem. And unless you actually can give it a lot more autonomy, like some of the other UN organizations, the UNICEF functions much better that way. Even ILO functions better with country contributions and less dependent on extra budgetary donor resources. So firstly, it needs to be better funded. Then it has to be given a lot more autonomy in terms of certain decisions, particularly in international health, in pandemic response. But if you're going to have your hands tied behind your back, and then if you're going to be only controlled by the member states, then colliding political interests are going to make it very ineffective. If you want it to be effective, you have to restructure it. And of course, unburden it of some of the bureaucracy. I'm not saying that it is not laden with bureaucracy. But coming back to Thomas Jefferson, that nugget of wisdom is not going to last long. No. Because as development proceeds, we find the pattern of risk factors actually reversing. And like in the United States, you find the rural areas now have more obesity, more hypertension, more smoking, and more cardiovascular risk factors than urban areas. So at the moment, Africa is protected. At the moment, rural India is better protected. But that may not be the state of affairs 30 years, 40 years down the road.
Yes, I mean, I've been worried about this forever, which is supersize me. And we have it all over the Western world. In Britain, Germany also, it's really quite astounding. And as you say, in this case, it provides more morbidity possibilities, but I'm not sure people will take the lesson. The other thing I do want to ask you about, of course, and a question has come in basically on this theme too, which is the inequality of supply. Now, it's difficult. I mean, I'm not a moral judge, and you know, I understand why President Biden politically and morally, and he's elected to protect his people, much as Mr. Modi is elected to protect his people, and the world is out there. And everyone says, yes, no one's safe till everyone's safe. I mean, it's a bit like the 10 Commandments. Everybody says, yeah, that's great. Now let's do it. So how can it be done better? And do you think, for instance, just for one example, the idea of waiving intellectual property rights on the vaccines, is it useful or is it just virtue signaling at this point?
Well, I think we've found creative solutions to that issue in the past. And I think PEPFAR, which is the President's Emergency Plan for AIDS Relief, really led in that 18 years ago.
Right?
By really, yes, under President Bush, to really create a waiver where low income and low middle income countries could get treatment, ARVs, the treatment for HIV, at an extraordinarily different cost by granting licensures to many companies like in India to produce drugs for low and low middle income countries. And because of that, today we have incredibly good drugs on the continent of Africa saving lives. In fact, I think the lessons will show that we were actually able to begin to control the HIV pandemic without a vaccine, which no one said would be possible to be able to do. And that's what is possible when the global community works together. So it didn't inhibit innovation, but it made life-saving, cutting-edge new technology drugs available to the world. I think there was a mistake early on by the global community by not investing in these new cutting-edge vaccines and technologies. And people made decisions that messenger RNA and some of these new technologies were going to be too difficult to expand. But if in January 2020, companies had done what the US was doing in expanding messenger RNA production capacity, the globe would have messenger RNA vaccines now. And so I think there is a lesson to be learned there. There was a global think that these kind of small batch craft beer could not be taken to exponential growth, but I think we see that it can. And so these are the kind, it's not just investments the way we historically have done, but it's investments in new technologies around the globe that will get us to a different place.
Dr. Reddy?
I entirely agree, because it's absolutely important for us to use the huge potential of the entire global community as it exists, whether it is scientific enterprise or productive capacity, in order to develop the solutions for what are likely to be the future threats. And we have seen that it's possible. In 1972, India actually opened up from product patenting to process patenting, and the entire Indian pharmaceutical and vaccine industry grew to become a global resource. So it can happen with other countries too. And we ought to really put together the best possible resources of all countries across the world to provide the fastest scientific progress in terms of shared technologies and information, and also the best possible production capacity as well. It's not just a matter of ennobling altruism, it's a matter of enlightened self-interest. Because if you don't do that, your own investments in other countries are going to collapse if their national economies collapse. Therefore, in this interdependent world, we need to protect each other, partly because it's the right thing to do, and partly it's also good for your own interest.
Yes, and also, I mean, it's always hard to convince governments to invest in something that is a potential problem. I mean, I'm very struck, for example, in France, which had quite a good pandemic preparation, that they let lapse. Everything got out of date, and they ran out of masks, and they weren't resupplying. And so they looked into the closet, and it was empty. And this is why I come back. We only have a couple minutes left, to something Dr. Burke said, which I believe, which is, a lot of this is politics. And a lot of this is the way our democracies function. I mean, one of Biden's real worries is to show the world that democracies can function for their citizens better than autocracies. So the last thing I actually do want to ask you is, China reacted very differently. I mean, let's leave the origin of the virus aside, but when they shut themselves down, and they shut down Wuhan, and they had party cells going from building to building. Now, everyone said this was impossible to do in an open society, but was it the right thing to do? And can it be done in other societies? That's my last question to anyone who wants to answer it.
Let me take it first. Okay,
please.
Dr.
I think I always want to come back, because I think you raise a critical point. But sometimes it's culture even more than politics. And I think democracies work when we listen to one another. And that was the advantage that I had being out in the States, as they call them, red states and blue states. It wasn't red states and blue states. It was our cultures of our rural communities and that self-reliance, because they're so far from their supply chain and hospitals, that they have a different sense of the medical system and when to utilize it. And we should be listening rather than pointing fingers, and listening to why people are hesitant about vaccines, and not just say, you over there, why aren't you getting this? That just is polarizing. The one thing, and
it's obnoxious besides. Anyway, go
that
ahead.
I have, but I see it happening again. You know, they're talking about red states and blue states and vaccinations. It's really our rural communities that have a different sense of the health system, and we should be talking to them, and we should be listening to them and responding to their concerns. And I think that same way across the global community. China was able to do things that in a free society we cannot do, but we have a greater strength. We have creativity and technology and the ability to listen to one another, respect one another, and develop our responses together. And I know that sounds Pollyannish, but I have seen it work. I've seen it work in Africa to control HIV. And it can be done around the globe, but we have to stop finger pointing and start listening.
Dr. Reddy, you have the last word.
Well, in autocratic countries, the discipline comes from fear, and discipline can be enforced. But in democratic countries, discipline can spring from trust. And that is where we must actually foster trust in the system and ensure that all the political actors, whatever may be their ambitions and aspirations and mutual combats, should actually unite during a period of emergency and collectively address the challenge so that the people can trust the response. I think it's very important for the leadership to coalesce together during the period of an emergency, almost as though it's a war, and then respond. And if people have learned to trust their governments, as some of the Western European countries you have seen very well, whether it is Germany or Sweden or anywhere else, at least there is, whether they've done the right thing or not, at least the people listen. And the same thing about Southeast Asia. So I think that is very important for us to ensure that the trusted communication continues on a regular basis, and we bring people together.
Well, I just want to thank both of you. I hope our watchers, listeners have enjoyed this as much as I have and learned as much. So to Dr. Birx, Dr. Reddy, my thanks, and I think everyone's thanks, and stay healthy, all of you, and best of luck. Thank you again.
Thank you.
Thank you.